And so Claudia and I started, well, this whole project really started quite some time ago, over 10 years ago. In 2013, I got a pilot fund from from Mycroft, the Manchester Institute of Collaborative Research on Aging. And I really have to thank Chris for this. It was at the time when I was finishing my another book project, which was my PhD and my postdoc. And something that I had observed in the field was that the role of grandparents in migration is really important. And then when I started looking at this literature, which is not something that I have a long background in, I realized that, well, as we know, the world is aging. We live in an aging world, and between 2015 and 2050, the world's population of older people will have increased significantly from 12 to 22%. And this pace at which the population is aging is much faster now than it is than it was in the past. And the other thing that I thought was really interesting is that by 2050, it's expected that the majority, up to 80% of the world's oldest population, will be living in low and middle income countries. So there is a really kind of strong connection here between development, between aging, and also between migration. So my background and interest are in gender and migration. And when I started looking at how much work there is on aging and migration, I found that there is some work, but most of it is in higher income countries. Most of that research has been focused on looking at, for example, domestic workers and how they support older people in Europe and in the US, or how migrant workers age in places of destination. So I found that there was there is some work, as Cathy and Michelle will, that their work testifies to this. There is some work on aging and also aging and migration in lower income countries, but it's quite a limited kind of body of research compared to everything that has been written about aging and migration. So when I started looking at this, I connected with my slides. Oh yeah, I connected with colleagues in Bolivia, particularly Claudia and also Maria Esther Pozo, and we started thinking about transnational care. So there is a body of literature on transnational care that really tries to understand how care is organized transnationally, so across borders and across social fields. And the main question that we really wanted to ask is what is the form of this transnational care? What form does this transnational care take in lower income countries? But because most of the work on this has been carried out in Australia and in higher income countries. But we also wanted to take this question a little bit further. We wanted to understand how transnational care practices also differ across socioeconomic status. So with this in mind, we started doing interviews, and this has been done in stages. So I'll pass over to Claudia now, who will talk a little bit more about how we organize the research and some of the research findings.
Thanks, Tania. Greetings and thank you to everyone for being here. I would like to briefly present key aspects of the fieldwork and the data collection process. So to investigate the relationship between migration and aging, we carry out 100 interviews, both men and women, plus 60 years and over from the regions of Cochabamba, Tarija, Santa Cruz, Oruro, and La Paz in Bolivia. As Tanya said, we started the project in 2013 with a pilot that was complete by January 2020, just before the COVID-19 pandemic's onset. And the interviewees were selected on the basis of their age and residence, aiming to gather data that will represent experiences of migrants' parents with differing socioeconomic backgrounds, living in rural, urban, and peri-urban areas. There was great variability in terms of education, livelihoods, and migration experiences. Fieldwork was neither easy nor straightforward, and the data collection process required careful planning. Our primary method was the semi-structured interview, guided by a set of core questions. So we adopted a relatively extensive yet flexible interview schedule, which enabled us to gather comparative material across all interviews, while also allowing participants the freedom to move beyond the set questions if they wished. Most of our interviews were Spanish speakers. Some had a preference to speak in their native indigenous language. Therefore, some interviews were carried out in Quechua, Guarani, and Guarayo, and we had research assistants who speak this native language. Although all three projects were led by Tanya, they were carried out through a highly collaborative process with different people and organizations contributing at various stages. The prior work of participating organization, the support of research assistant Sarah Roque, and the networks of family and friends were crucial in identifying older adults in the study regions. This groundwork fostered trust and facilitate informed consent. Most interviews took place in participants' homes, while in rural areas, longer stays were necessary to build contacts through a snowball sample and to conduct the interviews effectively. Well, this is a map from Bolivia, and the regions are in orange. Bolivia offers a particularly suitable case study for examining aging immigration, given its pronounced class and ethnic differentiation. This cultural diversity is reflected in varied social and family practice. Despite being one of the poorest countries in Latin America, Bolivia is undergoing demographic change. While it's still a young society, it has entered the early stage of population aging and is expected to advance in the coming years. Another feature of the Bolivian context is its legal framework for older adults. However, the implementation of these laws and access to basic service remain limited. The significance of focusing on Bolivia lies precisely in the challenge posed by its fragile institutional structures, especially in relation to the pension system and healthcare provision. Furthermore, migration is a historical and structural practice that has spread to all the regions of the country. So according to our data, migration shows clear regional contracts. Tarija in the south presents the most homogeneous pattern with intergenerational rural flows, almost exclusively to Argentina. Cochabamba in the center is more diversified, combining the migration of professionals and students with that of unskilled labor to Argentina and female care work in Spain and Italy. While remittances strengthen rural agriculture, Santa Cruz contrasts with its long history of internal migration, but with recent international flows, especially female urban migration to Spain since the 2000 and stage rural migration. Oruro sends workers to Argentina and Chile for agriculture and garment sector work, and to Europe for domestic service and care of older people, but maintains cultural ties through annual returns. And finally, La Paz, an economy based on service, but with a declining population, presents the greatest variety of destinations, regional and transoceanic, that encompass both skilled and unskilled labor. These some pictures in the Altiplano, especially. So, Tania, you can go on.
Right, thank you, Claudia. So given this diversity, we really struggled to find commonalities across the interviews. So as Claudia said, we had 100 interviews, great diversity in terms of migration history between the different regions. So what we did was we organized the findings across three main pillars, which kind of mimic the main literature on transnational care. So we looked at financial and material resources, health and care, and emotional care and well-being. And some of the findings here, just very briefly, was that so what we were finding was that there were really structural inequalities among the interviewees that were resulting from the way in which Bolivian labor markets are organized and the way in which social security in Bolivia is organized, which led to some of the significant inequalities we found in the way in which older people live their lives. So, for example, only 14% of our interviewees had access to a contributory pension. There is a universal pension, but it's only $36 a month that covers everyone who's over the age of 60, but this is not enough for people to live on. There was a high level of home ownership, but the great majority, so almost 3/4 of all of our interviewees continued working, and sometimes having quite difficult jobs. They would continue working on the land, despite the fact that some were in their 70s, in their 80s. It was a 90-year-old man who was washing dishes in the evening in a restaurant in order to get some food in the evening. And despite the fact that you might think that having children abroad, so all of the interviewees had at least some of their children abroad, they would be better off because they would be receiving remittances. Only a minority, so 44%, were receiving remittances from their children, adult children abroad. Even those who had caring responsibility for grandchildren, they weren't necessarily receiving remittances. And remittances were used for usually everyday expenses and documents, and medicines. In terms of health and care, this is something that also came out as being very important, particularly in relation to health. So healthcare was, across the board, access to healthcare was very problematic for most of our interviewees. And there was quite a high dependence on using traditional and herbal medicine and using indigenous healers, not necessarily because this was the interviewee's choice, but it was also because they didn't have, particularly in rural areas, they didn't have access to hospitals or doctors who are Western trained. And we found that our interviewees were both receivers of care and also givers of care. So many had caring responsibilities towards grandchildren, not necessarily the children of the children that are abroad. So sometimes they had children abroad, but the grandchildren were the ones of their children who might have been in Bolivia. And sometimes these caring responsibilities as grandparents increase their vulnerability, but not always. And finally, in terms of emotional care and well-being, we found that this really depended depended on temporality, so how long it has been. Some interviews responses to the children's migration really depended on how long ago their adult child has migrated, but also the history of migration. So in some places, like in Tarija, there was an expectation that children will migrate, and the parents themselves they were talking about teaching their children migration, teaching their children to migrate. And so this really kind of had an impact on how they responded to their decision, their children's decision to migrate. But also things that were really important for emotional care and well-being were social networks, so how well interviewees were integrated into the communities, whether they have access to communication, phones, WhatsApp and Skype, all these things really improved from when we started to when we finished data collection. And many of our interviewees were quite active in civil society. So just to finish off, in a nutshell, what we found was that this ideal way of this more classical way of understanding transnational care that has been argued by Baldassar and her co-authors, that care is possible across social fields. We found that this was only possible for the interviewees who are better off. So those who had access to income, had access to pensions, they were able to spend holidays abroad, they were able to see their grandchildren abroad, they were able to have access to private medical care, that had secured incomes because of having a pension. And the worse off interviewees often had children abroad who had undocumented migration status. They didn't have such a high income, so they didn't have access to visas. They weren't mobile across borders. So there was this kind of disparities between the better off and the worse off interviewees, with some exceptions between rural, urban and peri-urban areas that we don't really have that much time to go into. But also people who were making their living, their livelihoods off the land in Tarija, they had this transnational way of living, which also enabled them to practice transnational care. So there were instances where interviewees were going to assist their daughters, for example, when they had children, and the parents, the children would also visit parents. So there was this, we talk about this continuum of transnational care, and it was more possible among the interviewees that were better off, but also there was this one exception in Tarija. So that's kind of the book summarized. I think I've gone over time. Nobody's stopping me. So I'll stop there, and yes, I'll pass over to Kathy, who has very kindly agreed to say a few words about our book.
Yeah, thank you so much, Tanya and Claudia. So first of all, just congratulations for this beautiful, beautiful book, and for it being so interesting as well. This is a really careful and detailed book about what aging is like for the parents of transnational migrants from Bolivia. And what I mean by its careful scholarship is that you lay out your assumptions and also speak plainly about your reconceptualizations as a result of the research. So, for example, you discuss how your initial attention to region eventually became an attention to social class as a more important difference, or how you asked about the moment of migration and then realized it wasn't so important for your interviewees, but was sometimes merged with other moments of separation like marriage or new household formation. Although for some, that leave-taking was quite poignant. So that attention to different regions and socioeconomic classes highlights the heterogeneity of aging experiences and makes us attend to the historical and social context that generates migration. I agree very strongly with your point that attending to those left behind by migrants from the perspective of sending countries is really important for understanding transnational aging. And I think we too much understand it from the perspective of migrants, but that those who are left behind have a different perspective. And in particular, as you say, this perspective allows you to see older adults who've been abandoned or lost contact with their migrant children. So this is a deeply empirical book, and I appreciated the attention to the heterogeneity of the material and the way you carefully drew conclusions from those details. So I just want to comment on a few things that were surprising or interesting to me, or something that I think that we as migration scholars should attend to. One is that quite a few of these aging parents of migrants were migrants themselves in their youth, and introduced their children to migration trajectories earlier in their own lives. And so this speaks to the fact that in some regions of Bolivia, there have been long-standing histories of migration to neighboring countries, particularly to agricultural areas of Argentina. So thus, family life has been in part constructed through migration across one or two generations, and distance is not considered so extraordinary or contrary to family norms. So I really appreciate your expansion of the definition of transnational migration to mean, not solely international migration to global north countries, as is so commonly done in the migration literature, but to include international migration within the region, which is, of course, far more common than migration to the global north. The second surprise for me is that these aging parents of migrants were in such good shape, that so many were working at the time of the interviews and only a few needed care. And you explain this by saying that this aging trajectory is common in poorer countries where people enjoy a long third age of active life and then die quickly, perhaps in part because access to healthcare is so sparse. But it also seemed to me this trajectory was normative to your interviewees, and I'll come back to this point. So the third surprise was that the aging parents of migrants seemed on the whole to neither substantially benefit nor greatly suffer from their children's migrations. With a few exceptions, you give an example of an older woman who was taking care of two adolescents and didn't seem to be taking good care of herself. Very few lived in improved housing or had access to better health care as a result of their children's migration and remittances. Although 44%, as you said, received remittances, remittances were irregular and unreliable, as you document, and indeed many parents refused or were reluctant to receive the children's remittances, thinking their children needed it more. And in terms of suffering, perhaps what matters is that not all their children migrated, as I found in my research in Ghana also. So they didn't necessarily lack care just because some of their children had crossed a border. So my questions relate to these 3 points. You look at regional international migration, but not internal rural to urban migration or rural to rural migration, which I suspect has also shaped family life. And I guess I wonder whether you think your study's findings would be different if you had expanded your focus to include migration within Bolivia. And I guess another way of asking this question is, do you think transnational migration matters, or is it migration itself that matters? What might make transnational migration different from internal migration in the care and well-being of older adults? The second question has to do with, the people you studied were generally active and engaged. And I wondered more about what their narratives and theories of aging were, and whether there were any surprises for them in this process. I think one place where their stories emerge is when one woman tells a story of perpetual domestic violence, which damaged her body, and she continues to live with pain and disability from this violence. So this is not a story of aging per se, or even of an aging body dealing with the after effects of pain and domestic violence, but rather one of perpetuity and continuity. And I guess I wondered whether there were other stories of aging that you heard to give you a sense of people's own understanding of the aging process and what their expectations were of this stage of life, or whether they even thought of themselves as aging. Maybe an aging discourse wasn't so overdeveloped. I mean, I guess I just wondered whether there was a common discourse of aging that with which people were grappling or struggling with or articulating or finding themselves identifying with, in unity with, in a way. And then the third one was, given that the benefits of migration aren't coming to those left behind, I'm wondering why people migrate, I guess. So it sounds like there's no local critique of migration. People don't seem to expect more from their children, but I'm a little bit curious about what's going on. And one answer might be simply that migration isn't seen as a family project, but that the benefits are only expected to accrue to the migrants. And so I'm wondering just a little bit about, I guess, discourses of migration within this. So, yeah, I'd just be interested in hearing a little bit more about the norms of family life, of migration, and of aging, and how those are coming together or possibly being reshaped by your interviewees who are living with those experiences. And then finally, Tanya and Claudia, you do such a wonderful job of becoming a corporate joint author. I can't tell when one or the other is writing. You've successfully woven together your voices. And I wonder what recommendations you have for people who are researching and writing together so that they can produce something equally engaging and clear. So thank you so much for this empirically rich and thoughtful voice that's written so clearly and directly, which is so grounded in the complexities of what people told you, which challenged your own assumptions and which created new knowledge about aging and migration.
Wonderful. Thank you, Kathy. So we'll just move. I've noted the questions, but I think in terms of flow, we'll just move on to Chris and Michelle, and then we'll come back to provide some answers.
Well, it's a great pleasure, and I echo all of those preceding points, which it's a wonderful book, and it was really great, Tanja and Claudia, to have it the book in the Aging Global Context series, which I and Tony Calasantai and Tom Sharp at the time were editing, because it did meet the really core objectives of the series in terms of addressing global concerns about aging populations, issues around inequality, and linking the impact or the interaction between demographic change, movements between rural and urban environments, and of course the impact of migration. So, we felt we were very lucky in getting these themes expressed in the book, because it's often difficult as editors of the series to get proposals of this kind. And I'd echo the point about the quality of the writing and the collaboration. I'll come back to that. I think it's also the case, as the previous speaker made the point, that there is a substantial gap, and I think this is noted in the book, in the volume of research on aging between the global north and south. But it's not just the volume of research, it's just also that the dominant theoretical and paradigms and assumptions are still often drawn from the West. So I think the book is very important in challenging this imbalance and introducing significant new theoretical and empirical considerations. And I think it does bring together very nicely feminist scholarship, critical perspectives in gerontology, and of course insights from Latin American scholarship, which I really appreciated, and I think that blend is terrific. And of course, the project is a model of its kind in many ways, starting with a modest grant from the university, then with the British Academy, and subsequently Leverhulme. So you had a triple win, and that was very exciting. And of course, the collaboration between organizations, researchers, and older people themselves and the communities. And, with co-production, participatory research, very much in vogue, and again, I think, you have got an example of this. I would also want to highlight what I felt was really terrific, but very complex field work behind the study. And I think this aspect is often neglected in our accounts of research. Field work is difficult, really difficult, wherever we do it to some extent. But I think both of you made a really good account of the challenges which the team faced, the care-centered approach, as you called it, approach which you adopted, ethical considerations and so on. And I thought the kind of pages describing that were an important dimension of the study, and possibly the subject of another book, or certainly a number of papers could come out of that. No, I thought that description of the challenges posed by field work was very good. The study itself, I think, is very important in its findings about migration and older people, where it's true that in the early research, there was a kind of narrative of vulnerability in a lot of studies, albeit with important exceptions. And of course, one recalls the work on the role of grandparents caring for children orphaned through the HIV/AIDS epidemic, which was an important example of how grandparents step in terms of crisis. But you do get a great sense from the research, your research, focusing on the parents of migrants. This is an incredibly active group, as you point out, in terms of areas like employment, extensive and intensive informal care, and work in the community, civic participation, as you call it. Equally, though, I think what is also clear, drawing on intersectionality as a way of framing the data, and I thought that worked really well, was the great diversity and inequalities which were experienced and reflected in the interviews, and especially in terms of class, gender, and region. And again, I think this is a really important feature of the book, because a lot of the literature on grandparenting isn't sensitive to these class, gender, regional nuances. I think it's one of the big failings. I mean, I think we've moved on from the vulnerability tropes, but I mean, it's a problem with aging literature, gerontology generally, that it doesn't embrace social class, gender terribly well. And I think, this is one of the big strengths of this study. I also find, some of the issues, fascinating findings around issues relating to access to healthcare and the important role of the church and spirituality in people's lives. That's a very neglected theme, and I thought the discussion you gave about that was important. And I'd probably urge you to again, if you haven't written papers about that, I think that's worth doing, because I think there's more interest now in the role of faith communities in providing support of different kinds for older populations, but other populations as well. So a really great book. And I know Policy Press are very proud that it's in the Global Aging series, and I know I am. Just 3 points to think about, just to wrap up. Very important conclusion at the end about the pressures and indeed violence faced by many of the women who you talk to, and your conclusion that this, and I'm almost quoting, fails to receive sufficient attention from researchers and policymakers. So I think that was a real, I mean, you had that almost as your last sentence. And I think that is a major conclusion, actually, which, will be important, I guess, to take up further and encourage people to use the book to challenge some of those situations you describe. The second point I thought was about that, it does give you a different picture of the life course. Again, it challenges Western paradigms of the life course as having neat stages. The older people in your book and the migrants themselves have these very kind of confusing, messy life stages, and you wonder how those kind of it's a different kind of life course which has evolved, and you wonder how that affects experiences of later life, perceptions of aging, and various other things. So I'm very interested in how you get a different perspective on the life course from studies of this kind. And of course, I suppose the third point is using the book to think about the future of aging in Bolivia, given the demographic changes, which are going to be immense. Can we use the book to think about policies, looking ahead, policies which will provide more support to older people in Bolivia and to women and so on? So I think there's a fantastic amount there, and many congratulations to yourself and Tanja and Claudia, and a wonderful piece of collaborative writing.
Thank you, Chris. That's wonderful. So yes, I'll pass on to Michelle as the last speaker.
All right. Well,
thank you.
Congratulations to Tanja and Claudia for this lovely volume. I think that this is going to make a wonderful contribution to the literature on aging and migration all around the world. I really appreciate being invited to attend this event, and I echo the observations and points that my fellow commentators have already made. And I'm very much looking forward to the conversation at the end of this event. So I will move relatively quickly through my points, because I think a number of them have already been covered. I want to say that this is a really creative collaboration on transnational migration, and it interestingly combines both solid statistical data with an innovative research design and moving ethnographic materials. So I love that sort of intersectional multimodal approach. I appreciate the way in which this work foreshadows likely future experiences of the upcoming generation of older people around the world, and especially in the context of relatively weak health infrastructure and relatively weak social support for the poor. I think those are large-scale global problems, and that people will be able to turn to this work for insights about the situation and possible approaches. I also appreciate the way that the work examines really different migration circuits and their different effects on the older left behind population.
this intersectional approach that you've taken, the comparative approach across 5 different locations, across rural, peri-urban, and urban locations, and 3 different economic levels, as well as the different migration destinations, internal migration, regional migration, and south-north migration is really important. And I think that perspectives, that variety of perspectives avoids perhaps a trap of only having one field location and of assuming that location's patterns could stand in for what's going on in the entire country. And I would say that as my work being very grounded in one location, I was very impressed with the range of work that you two have done. I also really like the way that your analysis very deftly moves from rich data to insightful observations and patterns, and talking about, for example, the very detailed sort of local farming or job opportunities or lack thereof, and then talking about the structural elements of the local economy and their relationship to making migration inevitable, for example, from some of the poorer areas. I think that the work is also important for talking not only about rapid global aging, but also about a segmented labor economy with a hierarchy of destinations, and different border regimes for people with different documentation status, because that really does create an uneven playing field, and it's important to emphasize. I also appreciate the questions about the durability of family relationships and the care for left behind elders, because the work brings in so many complex webs that tie migrants and their families together as they experience lengthy separations and as they navigate these transnational spaces. So I want to conclude with some points about what stood out to me as of a special note, and also as areas of possible future study. One issue was this transformation of communication strategies and technologies between when you started in 2013 and when you finished up in 2020, with more phones and with people using WhatsApp, for example, to keep in touch. And this is, I think, a really important development. Tanya Allen, who is doing contemporary research with yours, talks about these connections between people and their technologies as care collectives, and kind of dives into that same topic from a science and technology studies approach, thinking about migrant nurses from Kerala, India, and how they take care of their families back home. And how they share the details of daily life with each other, how they can just hang out on Skype or WhatsApp to just be together at a distance. And these are really important and I would say life-changing and care-changing developments. So the fact that you have a before and after to compare, I think would be really valuable if you wanted to dive further into that. For me, another point is the focus on richer urban people who have, say, professional jobs, higher education, who have pensions, who have access to healthcare, and whose children migrate perhaps legally for good jobs with visas, and may sponsor their parents to visit, which is a really big contrast with the poorer rural people who have informal jobs, no pensions, basic or no healthcare, and whose children migrate either regionally or, if they go overseas, maybe go illegally with undocumented status and have a difficult time either returning to visit or sponsoring parents to visit. I think that juxtaposition could be a valuable sort of way of approaching these different migration circuits and the uneven playing field that people face. And related to that, maybe that question about mobility intensifying existing inequalities, which I initially found to be kind of a counterintuitive statement, but then thinking about those different comparisons between the socioeconomic class of the parents of the migrants. I thought that was a larger, very important point to make. So what's the time frame, though, for that observation? If people are migrating long term, if they find a good job in their destination country, if their migration status gets regularized, could that migration actually be a way of leveling some inequalities if the time frame were extended? Which ties into your very beautiful discussion of temporality and people's understanding of the loss of children and how that trauma, that wound, that deep loss is kind of sort of modulated or blunted over time. I was also interested in the role of the state in terms of old age pensions and healthcare, and the fact that Bolivia has this, excuse me for the pronunciation, renta dignidad, which is unusual for the region and I think unusual globally. And so that is an important issue to raise. What are the state supports and how can the state step in, or how should the state step in when children are absent? And also then the question of healthcare, of course, and what's available and isn't in these different locations. I was interested in the question of remittances and what people actually do with them, which is a fascinating question. And especially for the information that people weren't using them to build homes, because for me in my research in Sri Lanka, buying land and building a house were often the very, very first thing that people did. And also for the idea that maybe people weren't using them for medicine very much, because in my research, children used remittances for medicine, and that was a way for them to show everybody that they were going to private doctors and buying the most expensive medicines because they had the money. It was a status symbol for themselves and for their children. It was a way for the children to show up if they, with their money, even if they weren't able to be there in person. So that might make a really interesting comparative study, the use of remittances for homes and for medicine. And then in terms of grandparenting, I appreciated the point that the left behind grandparents or parents were still supporting themselves and also looking after the lands and the grandchildren in many cases, that they were not a burden. I think this is really important to emphasize, especially in contexts where people assume that the changing demographic ratios are going to definitely mean there's more older people who need care, right? That these older people are still continuing to work to reproduce themselves, to reproduce their family and their children. So I think the theme of sacrifice came up in your work, and I thought that was something interesting maybe to explore a little bit further. If they are finding the loss of children to be their own loss, why are they allowing that or encouraging that, right? What is it? Is it for the long-term benefit of the larger kin group that they're allowing or encouraging this migration? So with that, I'll conclude and thank you again very much for this wonderful book and its rich data and its deft analysis. And I look forward to the conversation that we will soon have.
Thank you. Thank you. These are absolutely wonderful comments. So I don't know if your experience is when you write a book, you're kind of stuck in the book and you don't really get a sense of what people make of what you're trying to say. So it's really wonderful to hear your observations, your questions, and all of your comments. So maybe I can take a couple of minutes to answer and then pass on to Claudia as well for a couple of minutes, and we might have a time for a few questions from the audience as well before finishing up. So I mean, yeah. I don't think I'll be able to, I won't be able to answer all of the questions, but it's really lovely to hear your observations, particularly in terms of where we could have gone and where we could go next with this work, and particularly with the violence that women have experienced. So we hadn't quite, so that was picked up by I think all three of you. It was really interesting when we were working, when these experiences, when we were working with these experiences, we weren't quite sure where to fit. I remember having that section of violence against women and how women continue to feel the after effects of the violence that they had experienced earlier on, well after, you know, they weren't in a violent relationship anymore. And I don't really think there is that much work on that area at all. So usually there is some work on violence that older women experience, but the violence that women continue to experience from the violence that they had experienced earlier on, I don't think there is that much work on that. But obviously Claudia is an expert on violence against women, and we both felt really strongly that we wanted to, you know, we had to include this in the book because it is a really important finding. And we kind of struggled because we weren't quite sure whether there were only some instances where this was linked to the absence of children at home. And so it didn't, for many of the things that we write, that the link to migration was quite tenuous. And we really had to kind of look into the data to find that connection with migration, because mostly what we found was, you know, were experiences of older people who live in different places in Bolivia and who have, you know, belong to different socioeconomic groups. But that link to migration, as Katy, as you said earlier on, was sometimes quite tenuous. And we also talked about, and this was, as you pointed out, because usually they had loads of children, and only some of those children went abroad. And in instances where that wasn't the case, the link with migration was much stronger. For example, women in urban areas whose, you know, only daughters had decided to migrate, then the presence of that absence, in a way, was very much there in their experience. But in instances where they had, you know, 6, 7, 8 children, only 2 of those were abroad, it was much more tenuous. And this seemed to suggest to us that, yes, that people migrate because they want better opportunities abroad. I mean, this was across the board. But although the decision might sometimes be a family-led decision, I think what really influences whether the benefits of migration rest within the migrants themselves or whether they're shared more broadly within the family goes back to how people think about the family and what are the norms that are associated with the kinds of responsibilities that children are seen to have. And for more middle-class families, there was a real sense that, oh, it's their lives and they should keep all of the benefits. And in fact, some were also contributing to their adult children abroad, they, you know, paying for grandchildren and things like that. While in other places that there was more of a sense of, so there were some Guarani communities and Guarani communities where there was the mode of living was intergenerational, and that's where you saw some of those benefits more shared more within the intergenerational family. But I definitely felt that what was missing is the in-depth approach that both Katy and Michelle, you have in your work, right? Because so we managed to have a spread of experiences because we went and did fieldwork in 5 different regions, but that didn't really, what we missed out was a more in-depth understanding of what aging means and about family norms and how that changes across different ethnic and language groups and different socioeconomic groups within Bolivia. And I think that's definitely something that, yes, if we were to have a second kind of take on this, it's something that I would be interested in exploring more. You know, almost kind of a similarly comparative project, but looking more in depth from different places within Bolivia, so that we get the breadth, but also the depth. So I think I'll stop there, because otherwise we're going to run out of time. I'll just pass on to Claudia, if you'd like to say something.
Yes, thank you very much for the comments and questions, Kathy, Chris, and Michelle. All the questions are quite insightful, and all these observations could be translated into several other books. Hopefully that will be the case. I can only say that there are many challenges and future lines of research. For example, understanding the difference between internal and transnational migration. And in fact, this was a point we discussed with Tanya after complete the field work. We will probably also need to analyze in discourse on migration, since while there are structural factors such as a lack of opportunities, but there are also other elements such as prestige and migration as an habitus. And I think that to further understand the link between migration and aging, it is also necessary to analyze discourse on aging more deeply. For example, from the perspective of living well, vivir bien in Bolivia, the figure of the older adult is very important and is associated with wisdom. And I think that there are a lot of challenge, but that's all. Thanks, Tanya.